Listeriosis is a foodborne infection caused by the bacterium Listeria Monocytogenes. This pathogen is commonly found in soil, water, and certain foods. It poses significant risks to specific populations, including pregnant women, newborns, older adults aged 65 years and above, and individuals with weakened immune systems. Understanding the clinical presentation, transmission, diagnosis, treatment, and prevention of this infection is essential for healthcare providers. Symptoms of listeriosis. The symptoms of listeriosis vary depending on the severity of the infection. In mild cases, individuals may experience fever, muscle aches, nausea, diarrhea, and flu-like symptoms. In more severe cases, if the infection spreads to the nervous system, symptoms may include stiff neck, confusion, headache, loss of balance, convulsions, or meningitis. These symptoms can appear up to 70 days after exposure. Pregnant women may present with mild flu-like symptoms, but the infection can lead to miscarriage, stillbirth, premature delivery, or neonatal infections. Fetal loss occurs in approximately 20% of cases, and neonatal death occurs in about 3% of cases. Transmission of listeriosis. Listeria monocytogenes is transmitted through the ingestion of contaminated food. Common sources include unpasteurized milk and dairy products, such as soft cheeses like feta and brie. Processed meats, including deli meats and hot dogs, are also frequent sources of contamination. Other high-risk foods include refrigerated smoked seafood, raw sprouts, and undercooked poultry. Pregnant women can transmit the infection to their fetus through the consumption of contaminated food. Diagnosis of listeriosis. Listeriosis is diagnosed by culturing Listeria monocytogenes from blood, cerebrospinal fluid, or other sterile body fluids. Invasive cases require prompt identification to ensure effective management. Early diagnosis is vital for initiating appropriate treatment and improving patient outcomes. Treatment of listeriosis. Antibiotics are the primary treatment for invasive listeriosis. Ampicillin or penicillin is commonly used, often combined with gentamicin for severe cases. Supportive care may be necessary for patients experiencing dehydration due to diarrhea. The choice of antibiotics and the duration of treatment should align with established clinical guidelines. Prevention of listeriosis. Although there is no vaccine for listeriosis, risk reduction strategies are available. Food safety practices include cooking meats thoroughly to a temperature of at least 165 degrees Fahrenheit or 74 degrees Celsius, avoiding unpasteurized dairy products, and washing fruits and vegetables before consumption. Preventing cross-contamination involves cleaning kitchen surfaces and utensils after handling raw foods. Storage guidelines recommend refrigerating foods at temperatures of 40 degrees Fahrenheit or 4 degrees Celsius or below and consuming refrigerated leftovers promptly. Specific recommendations for high-risk groups include reheating deli meats and hot dogs until steaming hot, avoiding soft cheeses unless labeled as pasteurized, and not consuming refrigerated smoked seafood unless it has been cooked. Key statistics. Listeria monocytogenes is the third leading cause of death from foodborne illness in the United States. Approximately 20 to 30% of listeriosis cases are fatal. These statistics underscore the importance of awareness and education among healthcare providers and patients. Conclusion. Healthcare providers play an important role in educating patients about food safety and recognizing early signs of listeriosis in vulnerable populations. By understanding the clinical aspects of this infection, providers can contribute to reducing its incidence and improving patient outcomes.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.